Okay, good afternoon, ladies and gentlemen. I am Margaret Poku Olatunde, the Membership Engagement Manager for the UKGCC. You are welcome to today's webinar organized by the UKGCC in collaboration with the Claron Health International. The UKGCC stands for the UK-Ghana Chamber of Commerce. As most of you know, it's a bilateral chamber that promotes business between the UK and Ghana. We have our three main areas of focus, which are our networking, advocacy, and trade services. Claron Health International is a well-accredited health organization in Ghana. Today's webinar is New Year, New Me, Achieving Your New Health Goals. It's a new year, and generally people are looking forward to live better, be healthier, especially amidst the ongoing global pandemic. So that is why we are doing this webinar. Today's webinar is going to touch on ways in which we can achieve these health goals. And this will cut across our diet, our general health, general physical activities, and the others. There will be a poll of questions during the presentation to ensure there's interaction between listeners and the speaker. So the speaker of today's webinar is Dr. Michael Acquah. I will go ahead and give a brief of who Dr. Michael Acquah is. So Dr. Acquah is a highly disciplined and dedicated patient-focused physician. He is licensed to practice under the Ghana Medical and Dental Council with garnered knowledge from being trained in both Russia and Ghana. He currently works at Claron Health International as the resident medical officer, head of the clinical department and pharmacy department. He currently holds the following certificates: ACIS, BLS, PALS, CPR, AED, and the first aid and general psychiatric management for BPD. So I'll go ahead and then give Dr. Acquah the floor. So Dr. Acquah, over to you.
Thank you, Margaret, for the introduction. All right, good afternoon. I am Dr. Michael Acquah, the resident medical doctor and the clinical director at Claron Health International. I do want to thank UKGCC for having me here for this opportunity. And I want to thank each and every one of you for making it and for joining me as I engage you on our theme for today, which is New Year, New Me, Achieving our New Year Health Goals. Okay, so our theme for today, New Year, New Me, Achieving your New Year Health Goals. I'm pretty sure as the year 2020 was getting to an end, and even so as the year 2021 began, most, if not all of us, had New Year resolutions. How to get better, and then how to be more productive. But then in order to achieve this, we most definitely need good health, especially during this pandemic of COVID-19. So I'm here to help walk us through some of these steps in order to achieve our New Year health goals. We really cannot have a discussion around this time of the year without talking about COVID-19. So COVID-19 is going to be part of our discussion today. So for a brief overview, we're talking about COVID-19. We're going to look at our daily routines, some habits and their effects on health, some common health challenges, and then questions and answers. And then before we start all this, I'm going to have to push a poll our way, so we take time off to, as we listen, let's answer some of these questions, because as the discussion is ongoing, we'll have some answers to this, and at the end of it all, we'll discuss the poll. So the poll is in progress. Thank you. So first off, we're going to talk about COVID-19, as I said earlier. So I'm sure people will be wondering why they name COVID-19. So COVID-19 is just an abbreviation for coronavirus disease that was discovered in the year 2019, somewhere in China, Wuhan. There's on my screen, we can see on the left the structure of what coronavirus looks like when we use the microscope, our high-powered microscopes to look at it. In the belly of it all, we have a coil, the golden coil in there, which is, and then it's surrounded by an envelope right there. And then on top of it, we have protein spikes. The protein spikes right on it is giving it what looks more like a crown. And then the crown in Latin is called corona. So the name coronavirus. And then since it was found in 2019, it's called the coronavirus disease 2019. Interestingly, for coronavirus disease, when it was discovered, it was thought of to have been an infection that animals, most especially bats, do carry. But then it mutated. It's been able to outsmart itself, and then it moved from a bat to a human being, and then it developed further. It's been able to mutate. It's been able to develop itself, so now it's able to move from human to human, making it much more deadly. So, how is coronavirus transmitted? I'm sure we all go about and we're wondering, coronavirus, coronavirus, it's everywhere. How are we getting there? Is it that it's just somewhere in the corner anywhere that we can just pick it up? Coronavirus is an infectious respiratory droplet that can travel, like usually when we cough, when we talk, when we sing. And then we usually give it a distance of about 6 feet that's able to travel. And then with this infected respiratory droplets, if it lands on our eyes, on our nose, and on our mouth, we are going to get infected with COVID-19. And then also when it lands on these infected droplets, when they land on surfaces, and then we get in touch with these surfaces, and then we touch men, which is mouth, eyes, and then nose, we are going to get infected. Using a mask can help reduce transmission. But then when you use a mask, please and please always make sure you keep a distance of about 6 feet from each other. So the risk groups. When COVID-19 started, as I'm sure we all might have heard, the older generations are rich, the older generations are rich. But right now you look at it and you realize the younger folks are also getting COVID, and then they're actually dying. So for now, I think it's safe to say that all age groups are at risk. But then those most at risk are the older age groups. That's people more than 65 years of age. And then of this, those aged between 65 to 75 years of age, about 20 to 5% of them have a mortality, have for the age group of 65 to 70 years, mortality rate is about 22% to 5%. And then for the age group of 75 to 85 years, mortality rate is about 4% to 10%. And then for those more than 85 years, mortality rate is about 10%. That's on the high side. Obese people are also part of the risk group. Others with some chronic medical conditions such as diabetes, hypertension, heart disease, asthma, emphysema, and also those with compromised immune systems. It could be either they're taking some medications such as steroids, or an example could be those suffering from HIV infections. So some terminologies as we go along, I'm sure we've all heard people say incubation period, infectious period, isolation, and under quarantine. What do they really mean when they say these things? So incubation period basically is the time from when someone is infected until they show symptoms. And then we have an infectious period, being the time during which one that's infected with COVID-19 can give the virus to other people around them. Then we have isolation. There is a term that basically or just means keeping the sick people away from the healthy people. So when we are isolating people, we are looking at the entire infectious period. We're trying to keep them away from infecting healthy people. And then the word quarantine is being used to restrict the movement of people that have been exposed to COVID cases. So just in case someone is taking care of a COVID case, we are like, okay, so we do the test, and then we don't know if such a person is infected or not. We are going to quarantine them for the entire duration to make sure that they don't pass on anything towards to anyone. So we have this illustration, this presentation right here. So as I said earlier, incubation period is a time from when someone is infected until they begin to show symptoms. So on the right of the screen, we have a graphical illustration where you would see that about 50% of people get to show symptoms by day 5. Then we have about 95% of people showing symptoms by day 14 of infection. There's also something to help us understand what we mean by the infectious period. So we have patient X gets in contact with an infected person, and then as we already know, say for COVID, the incubation period is from 2 days to 14 days. But then most people tend to show symptoms on day 5. But then looking at this, we have a patient that got exposed to COVID-19. And then on top, what we have from 0 to 30, that's the calendar days. But patient X started showing symptoms on day 40. 2 days prior to him or her showing symptoms, we consider that as an infectious period for such a person. So from the 12th through to the 14th, that person is still infectious. But then they are most infectious on the 14th day. And then we are saying for COVID-19, usually when people show signs or they show symptoms, for mild to moderate cases, it's the virus is going to be with them for about 10 days. So with a patient, patient X, who got exposed on who started showing symptoms on the 14th, they are going to have their infectious period being 2 days prior to them showing symptoms to 10 days after that. So from the 12th to the 24th day is when they are infectious. But then some people are also, how you call it, they present as severe cases, and they may take 2 weeks or more as to have to be in, how you call it, their infectious period. So for presentation, we actually have a lot of people walking about, moving around, and showing no symptoms at all. For such people, we call them asymptomatic cases. But then, they being asymptomatic doesn't mean they cannot, and I repeat, they cannot infect anyone. Then we have symptomatic cases. With this, we have people that will present with some mild presentations, moderate presentations, and then severe presentations. So with the mild to moderate presentations, they might come in with a fever. Usually fever is when you have a temperature of more than 37.5. They come in with some chills, fatigue, muscle pain, loss of appetite, loss of smell, loss of taste, some nausea, some vomiting, headache, cough, a sore throat. So usually these are the mild to moderate symptoms. But then for the severe symptoms, they appear to have difficulty breathing. They have some chest pain when they are breathing. Sometimes it's so bad they have blue lips. Some actually have difficulty waking up, and some actually wake up with shortness of breath. Others are confused, they have loss of speech, and then loss of mobility, sorry. So with investigations to know who has COVID-19 or who might have had COVID-19, we have diagnostic tests, and then we have a test that can determine if someone has a past infection. So with the diagnostic test, we are looking at the PCR test and then the antigen test. And then the test to find out if someone has been infected before, we do the antibody test. So for management of COVID-19, I'm sure we all know there is no cure for COVID-19. So basically what we end up doing is supportive management. And by this, we end up putting people on regimens to help support their immune system so they are strong enough to fight the virus on their own. So with this, you might end up introducing into their lives some antibiotics, immune boosters, which will include zinc, vitamin C, vitamin D. We can also start them with some pain relief, and then we'll advise adequate rehydration. And then for severe cases, we would have to hospitalize and manage accordingly. So some tips on prevention of COVID-19. So basically, it's actually very clear. Let's learn to avoid men and follow women. What I mean by avoiding men basically is let's avoid touching our mouth, our eyes, and then our nose. Then what I mean by following women, I'm not saying we should just go down and start following the women, please. That's not what I'm saying. But what I mean is let's learn to wash our hands. Let's obey social distancing. Let's mask up, exercise and eat well. And please, no unnecessary traveling, partying, and chilling. There's a nice picture I saw while I was presenting, while I was coming up with the slides that it would be nice for me to share with you. But I know the ladies are going to have their reservations. So the guys, we'll meet them later and then we'll battle this out. But then let's treat our mask like our panties. So one, let's learn to wear a fresh one every day. Let's not adjust or take it off in public. If it's old and it's sturdy, like it's torn, please throw it away. Don't wear it again, please. So those of you wearing the torn panties, please, that's not how we wear it. If it's torn, if it's old, please throw it away. Let's learn to keep it dry and make sure we keep it clean. It shouldn't be likely to fall from the face. It should be comfortable. It shouldn't be too tight on the face. It shouldn't be as if it's going somewhere. It's one eye and then one on the mouth. No, that's not how it's supposed to be. But it's supposed to be nicely worn. And then it's supposed to cover everything that it's supposed to cover. So ideally, your mask is supposed to cover your nose, cover your mouth, some part of your chin, and then how do you call it? Your face. And then we have to wash it like our delicates. That's separately and using the right temperature. Never wear anyone else's and never give yours out. Then please and please, those that have the mask with tags in, make sure the tags are always tagged in right. So I'm saying, if you feel sick in this time or in this era, I would advise you call your health provider and ask for advice. But if you really have to make it to the hospital, please and please learn to maintain a distance of at least 1 meter, or about 6 feet from others. Learn to clean your hands frequently. Almost all the health facilities now have dispensers, so you please make sure you disinfect to clean your hands frequently, and then you wear your mask, please. And then also, when you have to cough or you have to sneeze, always make sure you use a tissue and you dispose it off in a bin. Or if you don't have any of this, please and please, you can use a flexed elbow. You cough or you sneeze in a flexed elbow. After which, you please try to wash your hands with soap and the running water, or you can use an alcohol-based hand sanitizer to clean your hands. So there's another illustration, how not to get COVID, how to protect yourself and to protect others. So you keep a distance of about 1 meter. No need to be shaking people right now. So you can just give them a wave. They will not understand. Please try not to give handshakes. And then the doorknobs in our offices, at home, wherever, even the car handles, the car doors. Please and please, let's try and disinfect them. And then also, when we touch handles, let's try and wash our hands with soap and the running water, or we clean with an alcohol-based hand sanitizer. So just an information I would want to share with all of us. I'm sure some are interested to know how to care for their COVID, just in case you have a relative or a friend that's been exposed to COVID-19. How should I wash and dry clothes, towels, if someone in my household is suspected or confirmed COVID-19 patient? So basically, such a person, you have to wash their clothes, their towels, and whatever it is they have separately. If possible, wear heavy-duty gloves before handling them. Never carry their stored linen against the body. And I repeat, never carry it against the body. Make sure you put them in clearly labeled leak-proof containers, which could either be a bag, a basket, or a bucket. And then you have to wash and disinfect their linen. If you're going to use a washing machine, let's wash it at 60 to 90 degrees with a laundry detergent. Alternatively, if you don't have the washing machine, you can soak it in hot water and soak in a large drum. It's not as if you hate them, but you can use a stick to stir the solution out. Okay, with their clothes and everything, use that to stir, but please avoid splashing. And then if the hot water is not available, you can soak it in 0.05 chlorine, that's bleach, for approximately 30 minutes. And then you can wash. And then you dry it in sunlight. But then please and please again, let's wash our hands at the end of all this. And some also are wondering, banknotes, coins, papers, if I use them, am I going to get COVID-19? I have a container at home actually where I keep these coins. So if you have them, just let me know. I'll keep them in mind when it's time to come for it. And that's a joke. Either ways, there's been nothing to confirm if it's possible for you to transmit them via coins or when you're using papers. But then this is it. You never know who actually handled the banknote or the coin that you're having. So please and please, when you use them, please try not to touch men, that is your mouth, your ear, your eyes, and then your nose. But you try and clean your hands before you do anything else. When I mean clean your hands, you have to use an alcohol-based hand sanitizer, or you wash with soap and the running water. So we're going to move on to some healthy routines. Because before COVID came, we had a life. So we're going to move back to our normal healthy routines. So let's learn to sleep well. Drink water when you wake up. Exercise, even if it's for 10 to 20 minutes, that's fine. Let's learn to meditate. Let's eat breakfast. A lot of people are not eating breakfast. I'm sure if I start asking questions now, like half of us didn't have breakfast today. So please and please, let's learn to have breakfast. Then let's plan a day before we leave the house. Hey, almighty, This, this by people, I think should be the easiest of jobs. Amazingly, a lot of people actually come to the consulting room with complaints about sleep. And some friends actually even call with issues with sleep. Yeah, I wonder, why can't you sleep? So then ideally, we're supposed to be having about 6 to 8 hours of good sleep. Ideally, you're supposed to have 6 to 8 hours of good sleep. But you take a poll run and you ask around, someone will tell you, oh, I slept around 12, woke up around 2, and I couldn't sleep again. What did you end up doing? They'll tell you, oh, I was on the phone because I couldn't sleep. Or I picked my laptop to do something else. Introducing all these factors into your routine, you woke up, you decide to go to work again, you wouldn't be able to go back to work. So please and please, when you wake up in between, stay away from your phone, stay away from work-related stuff, and get some sleep because you need about 6 to 8 hours of good sleep. But sleep actually serves as a reset button. So it's going to help restore and maintain your mood, your memory, and it's going to make you actually feel refreshed. So please and please. And also, yeah, I think it's a point that we should all know. Next time you are all moody, if someone calls your name, Margaret, you're like, hey, what I want, please and please, let's check how long you slept. For those that like the food, usually when we wake up, the first thing is thinking about food. No need to even drink water. It's very good. Our food is very, it's important. I actually like food a lot. Then, we have to make sure our diets are balanced. And I can't stress on it enough the benefits of eating healthy meals on the heart. It really cannot be overemphasized. So let's make sure to eat a variety of food, including a lot of fruits and vegetables. Let's incorporate into our daily routines healthy snacks. And with healthy snacks, I'm asking us not to just go by the mark to go buy some fizzy drinks and then get some chips or whatever it is. But let's learn to have, we can have some raw vegetables, some fruits, dry fruits. They all help. And then even some unsalted nuts, they can help snacks. So let's incorporate that into our daily routine. The next I want to talk about is to ask us all to cut back on our salt intake. For some people, if there's no salt in the food, hey, I can't eat that food though. And ideally, we're supposed to be having about 5 grams. That's like a teaspoon of salt in a day. That's the maximum we can have. Or some of us, when we are cooking, we pour the salt inside, we just keep pouring until it tastes good enough. So please and please, ideally, we're supposed to have about 5 grams, just a teaspoon a day. So for those of us who want to have a lot of it in, Dr. Acquah is saying you're not supposed to, you can introduce some spices and some of these dry herbs into our foods, and it will help make the food taste better. And we should also learn to check on labels and then make sure they actually have very low sodium content. Because actually a lot of salt also puts us at risk of having these heart conditions. Let's also learn to cut back on our fat. Very important. A lot of us, excuse me, say we like it when it's sauté, when it's oily enough, or you press on it and the oil is all over, like it's on our hands. That's when the food is delicious. It actually looks good sometimes, but trust me, you really don't need that much oil in the system. So let's learn to cut down on the oil. And then I also advise, there's this oil we call trans fat, TRANS fat. That's the deadliest, the baddest of all the fats. And this is actually industrially prepared, where the liquid fats we have is converted into solid fat and then it's stored. So let's try to limit or avoid them totally if we can. So let's learn to reduce our butter and margarine and go for healthier options like olive oil, soy, sunflower, and even corn oil when you're cooking. Then let's choose meats like poultry, or basically the ones that are low in fat. And then let's reduce the, how do you call it, the red meat. Okay. And then let's also try and then have more boiled and steamed foods as compared to having fried foods. When I was saying let's reduce or let's avoid trans fat, I'm sure people are thinking it's going to be easy, it's going to be easy. But we have our fries in there, we have the burgers in there, we have our fried chicken, we have pizza, there's donut, and that's actually my favorite. But becoming a doctor right now, I've tried actually limiting it. So please, you should also try and limit yours also. Then we have popcorn. And I've heard of it. Most of them are not going to cinemas anymore. But we still sneak and then we get some popcorn once in a while. But please, let's try and reduce all this. And then when you buy stuff off the shelves, let's look at the labels and make sure the trans fat is not there, or it's very low. Some of them are smart enough, they put it their trans fat is 0 grams, like there's no trans fat. But you look at the ingredients, you might see it written there, partially hydrogenated vegetable oil or just hydrogenated oils. So let's be careful with the things we put out. Then let's also learn to reduce the sugars. Consumption of this actually poses us a lot of health risks. And then so our advice, let's choose some fresh fruits instead of these sweet snacks such as the cookies, the cake, chocolates, and the fizzy drinks. Okay. And let's try and do a lot of water instead. So ideally we're supposed to be having about 2 to 3 liters of water every day. And with this, I'm not asking us to go for the flavored water or supplementing with these fizzy drinks, Coca-Cola, Fanta, and the rest. No, let's try and limit the sugar intake, but let's drink a lot of water. Let's also learn to avoid alcohol or keep it to the barest minimum. That's if you're going to drink. I'm sure when COVID came, I just was the opinion, okay, so if I'm going to use an alcohol hand sanitizer to clean my hands and that's going to kill COVID, why not drink the thing instead? Even if I have COVID, it's going to kill the virus. But please and please and please, drinking alcohol is not going to kill the COVID. Nah, not at all. So please and please, even you drinking alcohol actually is putting you at a lot of risk, a lot of accidents. You can bump your head, you can fall, and even your organs. You can end up having kidney issues, liver issues. So please and please, if you can, let's stay away from alcohol. Now let's look at my people, those that end up sitting a lot of sitting. People have sat down. Now we actually have a phrase point for you guys. Sitting is the new smoking. It doesn't mean when you don't want to sit, go and smoke. No, that's what I'm saying. But then the problem of sitting for so long is so bad that medics now equate sitting to smoking because prolonged sitting is going to shorten your life. Because even sitting for as little as, what do you think is little, but sitting for about 2 hours is going to increase your risk of heart diseases, diabetes, some cancers such as colon cancer. It's going to give you a lot of back pain and even neck pain and other orthopedic issues. So please and please and please, let's learn to limit the number of hours we are sitting. So we can be sitting for about 30 minutes and make sure in between we try and then exercise just a little bit. So you sit for about 30 minutes, you get a break of about a minute or two, you stretch, and I think that should be fine. And then we can also incorporate into our daily routines, having standing meetings or walking meetings, just like the way medics or medical doctors or those in the medical profession, they have their meetings. When we go for ward rounds, we don't end up sitting, or we move from patient to patient and discuss cases. So I'm sure the CEOs, the big shots, and everyone around, we can incorporate this into our routines. Exercise. Most people say they actually do not have a lot of time. They have no time at all to exercise. Hey, God, when I wake up, I have to go to work or I have to do traffic and everything. That's fine. I'm begging of us all. It's a new year, new me. So let's give ourselves about 10 to 20 minutes a day, just 10 to 20 minutes. And then with this, when you wake up, give yourself 10 to 20 minutes. You can do some squats. Let's say you're squatting just 10 squats. You're not going to do plenty, just 10. If you can do some push-ups, let's do about just 10 of those push-ups. If you can do some sit-ups, let's do about 10 or 15 of them. We can skip. I actually like skipping a lot because skipping is more of a compound exercise where we get to exercise almost every part of the body. So we can skip about 20 or 30. I'm sure within 20 minutes, we can do a little bit of each of these four things I listed. And then at the end of the day, when we get home, we might feel too tired, we just want to go shower. But just love yourself just a little bit more. It's a new year. You can walk to the next junction, just a brisk walk. When you come back, you shower. You can end your day with that. In retrospect, from COVID to dieting, to sitting, to exercising, if we avoid it, if we decide not to do anything about those, we're actually going to we are going to welcome the silent killer, stress. Then we actually all have different ways to define stress. If I should ask all of us, what is stress? Someone is going to define stress based off on relationship issues. Others is going to be based off on what they're going to be facing at work. Or there's some business that's actually pulling them back. We have different ways. Others actually hunger. Hunger is stressing them. So we have different things that are going to stress people. But then stress just basically is your body's reaction to a challenge or a demand. That's basically what stress is. So as we have different ways we are going to define stress, that means we have different stressors, things that are going to stress us. So we have to manage stress, or stress is going to manage us. And the best way to manage stress, you identify and then you limit or you reduce your exposure to the factors that are going to stress you. So if it's work related, let's learn to plan our day, plan the routine, the things you're supposed to do. Instead of going to meet up with someone and then have a chat with them, why not finish what you have to do at work? And then you can go meet your other colleagues and have a chat with them. Because at the end of the day, when they are done and they're out, you're going to be stressed and thinking, how come I can't finish my work? Then whatever it is you're unable to finish in a day, you're going to carry it on to the next day. And that's going to become a compound stress. And then again, we always learn to ask for help when necessary. And please, you shouldn't do it all. Let's also learn to meditate and let's learn to find our calm environment. For some people, it's swimming. For others, it's jogging. For some, it's listening to music. So try and identify yours and help calm yourself down. And also, let's not forget to take the break when we have to. We all have leave days, so let's learn to take our leave days. But now with COVID around, we are unable to travel. But then there are better days are coming, so no stress. Just learn to take your break and reduce your stress. With all that has been said, I want to take our attention to some common health challenges that patients or people tend to present with, actually very common around us. The first I want us to look at is hypertension. So we all have blood pressure. Some people will come and they tell you, doctor, I have blood pressure, I have blood pressure. For me, I get to understand what they mean by that. But then everybody has blood pressure. That's what the blood needs. We all need some, it needs the pressure to be able to move. But then when it's high, that's when we call it hypertension. And with this, when we say someone's blood pressure is elevated, it's when it's more than 140 or 90. A lot of people actually walking about asymptomatic, they show no signs, no symptoms of being hypertensive until they walk into a facility or they get checked and their BPs are high. But those that present with signs and symptoms, they have headaches, dizziness, vomiting, weakness, and for some, they come and they tell you, oh, my heart is beating so fast as if someone is trying to pull it out of my chest. So what are the risk factors to look at for hypertensives? So age, advancing in age is one. A family history of hypertension. Those that have health problems such as obesity, diabetes, kidney diseases, um, their gender. Yeah, men are actually at a higher risk of getting diabetes, hypertension. The black race is at a risk, and then our lifestyle, looking at our diet, our sedentary lifestyle, stress, smoking, and alcohol. Then, when you have your blood pressure checked, or you have any of the symptoms I mentioned about, being headache, dizziness, nausea, vomiting, or what it may be, please visit any health facility to get it checked. But then when you get it checked, or when you visit the health facility, you don't just rush and put you on medication, as some have been made to believe that when you go, they're going to put you on medication. So no, we actually have different ways of managing. We have ways of managing medication. Usually, based upon the presentation, we can start with a conservative management. And in this case, we're not going to start your medications, but lifestyle modifications. So we are looking at your diet, we are looking at your sedentary lifestyle, we are trying to correct your obesity and all these things. So if these are not helping, then we might have to consider pharmacotherapy, where we are going to introduce medications into it. So the next one we're going to talk about is diabetes. For diabetes, it's just a condition that's characterized by having very high blood glucose level. When you finish eating and then you check your sugars, it's going to be high. So you're not supposed to be so scared. After 2 hours, usually when you check your sugars, your blood sugar is supposed to be normalizing or normal. When you wake up in the morning and you have your sugars checked and it's more than 5.5, then it's an issue. So ideally, your normal fasting blood sugar level should be between 3.3 to 5.5. There are types of diabetes. We have type 1 and then we have type 2. And for the type 1, that's usually for juvenile diabetes, and that comes usually before 30 years, before 40 years. They are usually the type 1 diabetics. The type 2, that's non-insulin dependent diabetes, and they come later in life, usually based off on our lifestyle. So the signs and symptoms for diabetes, we have frequent urination, frequent thirst, unexplained weight loss, fatigue, weakness, numbness. Some come with blurry vision, and then for some, they have the full breath. So what are the risk factors for diabetes also? Family history of a diabetic, those that are inactive, others that have some health issues such as hypertension, obesity, and then cholesterol issues. The age is also a factor, and then the race, blacks, are also most at risk of having diabetes. And then we are looking at obesity, the almighty obesity. People see them and call them obulu in our local dialect. Usually it is when someone has an abnormal or excessive fat accumulation that presents a risk to their health. So the risk factors was putting someone at risk of being obese, example, sedentary lifestyle, stress, dyslipidemia or cholesterol or liquid issues, poor dieting, hormonal imbalances, genetics, medications such as steroids, also boosters. So signs and symptoms of people that are obese when they present, get to know, notice they have excess body fat accumulation, particularly around the waist. Some have shortness of breath, others snore, others have trouble sleeping. This is the inability to perform simple tasks, which usually they will be able to perform with ease before they have gained weight. So we're looking at complications for all these things I've mentioned. We're looking at diabetes, we're looking at obesity, we're looking at hypertension and others. We can have very serious complications which can be life-threatening. An example of which is stroke. Others also present with vascular issues and nerve issues. Others have this piercing, pins and needle sensations in their neck, in their limbs, mostly related to nerve issues. And then for others, sadly, they will have to have their limbs, their hands, their legs amputated. Others have end organ damages where they have issues with their eyes, which we call medically as retinopathies. Then for others, they have this kidney-related conditions as chronic kidney disease. So to reiterate, however, for accurate diagnosis, monitoring, and effective management of any health condition that you have, our advice is swing by my facility at Claron Health International located at airport to have yourself properly checked. The services that we run, we have OPD services, specialist services such as pediatrics, we have an OBGYN, obs and gynae specialist, we have a urologist in-house, a dietitian, an orthopedic surgeon, and a whole lot. We are into oil and gas certifications, medical screening and wellness talks. And then we recently launched our Claron Dog champion telemedicine in Ghana. We do COVID-19 testing. We are certified. Home care with mobile lab and pharmacy. Have emergency services. So if you need your ambulance or you need your medical evacuations, you can contact us. We also provide medical staffing and then health training and audits. So thank you all for having me.
And thank you very much, Dr. Michael Acquah, for your presentation. It was very, very interesting. I learned a lot of new things myself. I never thought of how stressful it is to be catering for a family member or friend who actually has COVID. I mean, cleaning their things. I never thought of how difficult it was going to be. And I never knew that popcorn had trans fat as well. So I've learned a lot of new things today. So now we are open for the question and answers. So you can either click on the raise hand button and then I'll call you and then you can ask your question, or you can put your questions in the chat box and then I'll read them out. Earlier on, we had Beno Adams with your hand raised. Do you still want to ask a question? Okay, I think we've lost him. And we have Felix Acquah. He has a question as well.
Yeah, my name is Felix. I dialed in from Frisco, Texas. And I have blood pressure, high blood pressure, and I'm on medication. But the question I have for Dr. Acquah is, even with my medication, there are days that I have these severe migraines, So I'm not too sure if the high blood pressure has got anything to do with the migraine, or if I need to go back to my personal doctor, so I will take a look at my prescription again. So any thoughts would be very helpful. Thank you.
Okay, so Mr. Felix Acquah, thank you for that. So about your migraines, I would want to know if you okay, so if you've been having migraines prior to you being hypertensive, you can have your migraines again. But actually, migraines have trigger factors. So you have to know your trigger factors and avoid them. For some people, it's hunger. For some people, it's extreme when there's too much noise. For some people, when the lights are too bright. For some people, when they are constipated. There are different reasons why you can have migraines. So if you have migraines, you have to learn to avoid those factors. You feel better. But then again, you can confuse your headaches, as in the migraine headaches, with a warning about your pressures being extremely high. So our advice when you have your headaches, please and please check your blood pressure and then make sure you take your medications. You ensure you go on your dietary advice and your lifestyle modifications, and I'm sure you should be fine. Thank you.
Excellent. Thanks very much, Dr. Acquah. And
you're welcome, Mr. Felix.
Okay, thank you, Felix Acquah. I also have a question here. It says, the symptoms don't seem that serious. They seem like common cold symptoms. What accounts for the numerous deaths then?
Okay, so for this, a number of people have underlying conditions. Underlying conditions, you have a lot of people actually even being hypertensive without them knowing they are hypertensive, being diabetic without them knowing they are diabetic. And then with COVID, it's a viral infection. And with viral infections, they can also suppress your immune system, and you get what we call opportunistic infections coming in. So all these will tend to complicate issues, and they are going to increase or put you at a higher risk of death. And then again, we also have what we call happy hypoxia, which a lot of people do not seem to know. Usually we get to see this in hospitals where we use a pulse oximeter to check their oxygen concentrations. Ideally, it's supposed to be reading from about 96, that's the lowest, to 100. So that's your oxygen carrying capacity. It's supposed to be from 96% to 100%. But what we've noticed for COVID patients, their SpO2s can drop as low as 50 or 60 without them showing any signs of symptoms at all. But others just ignore and say, oh, nah, it's just the way I feel when I have a cold. So we ignore all these basic things, and this pushes us closer and closer to them. So I'm sure that's how come we have a lot of mortality cases.
Okay, people are asking about the polls, and I assume that we've already answered most of the questions, but Dr. Acquah, do you want to go through the questions and answer them? Definitely. I mean, you answered them throughout, yes.
Okay, so the polls. Wow, I'm impressed. In which year was COVID-19 discovered? And a lot of people went for 2019, which is the right answer. Why is it called coronavirus disease? We had the first option being protein spikes from corona on the surface. It was discovered in the province of Corona. And the answer I liked a lot was the one who discovered it was called Giancarlo Corona. But it went for the right answer, which is protein spikes on the corona. From corona on the surface, sorry. Then how is it transmitted? The options we have here: infectious respiratory droplets, contact with dusty surfaces, and then communal gatherings. The majority, representing 22 people, went for infectious respiratory droplets. I have another question about consuming alcohol can help cure COVID-19. So I can see my people here don't like drinking alcohol. So we all went for the right answer, which is false. Coronavirus cannot survive on surfaces. A number of people chose true, and then majority chose false. And the answer is false. Is there a cure for COVID-19? The answer is no. The majority of people here chose no. So congrats to all that chose no. How many hours of sleep is adequate for an adult? So we have 6 to 8 hours, 4 hours if you want to be a billionaire, which kills me. 4 hours to be a billionaire. That's interesting. And then we have over 8 hours. The majority of us had the right answer, which is 6 to 8 hours. So congratulations. And then trans fat is the best fat available. And then the answer to this is false. The majority of us here also chose false, which is good. How much water is considered adequate in a day? Some actually went with drink till you can't drink no more. Others were like no limit, but the majority of us had it right, having 2 to 3 liters in a day. And the last question was about our sitting habits. So sitting for 2 hours straight is great for your health. The answers we have true and false. The majority, and actually I mean all of us, went for false. And that was right. So congrats on you all who chose the right answers. And better luck next time to do so. And I hope we actually did learn something from this presentation. Thank you.
Okay, thank you, Dr. Acquah. It looks like we have quite a number of questions. We'll have to run through it. And we have Nanaya in Cancer. She has her hand raised. Nanaya, you can go ahead and unmute yourself and then go ahead with your question.
Yeah, hello, good afternoon, everyone. Dr. Acquah, my question is on fruits. For us who like to take smoothies, there's I think there's some people actually think there's too much. I mean, people who like pineapples, apples, or probably mangoes, they said there's too much sugar in them. Is it healthy sugar or is unhealthy sugar? Is it too much to eat too much fruits?
So all I want to say for now is too much of everything is bad. So our advice, yes, so having fruits is good, but too much of it, I won't advise us to. And then it has sugar in it. So definitely, as I'm saying, we should have fruits, but then let's do it in moderation. I think it should be good.
Okay, thank you, Nanaya. I hope your question has been answered. We have another question that says, can diabetes cause blindness?
Yes, please.
I think I would like to know how it causes blindness.
Okay, so with diabetes, we have what we call, it's a complication we call diabetic retinopathy. So that's how it's going to cause what we call blindness. So those that have severe forms of the retinopathies are at risk of going blind.
Okay, thank you. And we have a question from Sarah Adelaide Dampton. It says, I understand vitamin D is good for fighting COVID-19, and in Africa, we can have it from the sun. How long would you suggest we stay out in the sun, or how much of the sun is adequate?
All right, this is an interesting one. So we believe vitamin D coming from the sun is usually in the mornings, right? So ideally you can just go sit under the sun, and I don't mean you should take a chair and go sit in the sun purposely, but you can actually rest where the sun is not too high up. For about 20-30 minutes in a day should be fine. Being exposed to sunlight for about 20-30 minutes in a day should be fine.
Okay, so is the vitamin D only morning sun? And what time does morning end, if I may ask?
So it's not only morning sun, and studies is showing vitamin D from the sun is lower, usually getting to about 11. So we're looking at from about 7 to 11. In the later part of the day, I think from about 3 to about 6, that should be about it for vitamin.
Oh, okay. Okay, thank you very much, Sarah. I hope your question has been answered. Sarah has another question. It says, is the oximeter necessary for only COVID-19 patients, or should every home have one just in case?
Yes, I'm going to advise every home has one just in case. Also looking at the hypoxia, I would suggest we all have a pulse oximeter to check our pulse, to check our oxygen concentration levels once in a while.
Okay, thank you. And we have a question from Gilbert and Sutechi. He says, is emaciation a symptom of diabetes? Emaciation?
Yes, please. It is a symptom of diabetes. Weight loss. So it is a symptom of diabetes.
So it's drastic weight loss.
Weight loss, yes, please.
So not every skinny person.
So let me reiterate. So for the symptoms of diabetes, someone urinating frequently doesn't necessarily mean they have diabetes. You could also have just a urine infection, a urinary tract infection. Someone losing weight doesn't necessarily mean they are diabetic. They could have other health conditions. So that's why I advise, in case you have any of these symptoms, please visit the health facility. We have a lot of questions we are going to ask. Some labs we have to do to make sure we know exactly what is happening.
We do have a lot of questions. Okay, Felix Acquah says, just checking in. Is there an award or prize for getting all questions right? Next time, I'm sure we'll have an award, but now we don't have any awards, unfortunately. Sarah Adley has another question. Please, can you say something small about the neem leaf infused steam therapy going around social media, touted as a good preventive measure against COVID-19?
Okay, so for the neem leaf, I don't have any scientific paper on that, and I haven't read much on that to say anything. But personally, I don't think it's a bad thing. But then my only worry will be when we tend to do too much of everything. So just a little bit of everything, as I always say, is good. So let's avoid having too much of the neem leaf infused steam inhalation therapy.
What could happen if you have too much of it?
Okay, so when you have too much of it, you can irritate your nasal passages, which is a good thing, also putting a risk of having other forms of infection. You can scar your upper airway. And all these things I would advise. So that's why I'm going to advise you to not do too much of the mainly steam infused therapy. For any steam infused therapy, yeah, basically that's the reason why.
Okay, thank you very much. We don't have a question, we have a comment. Hello everyone, I'm Mrs. Ruby Logo, country representative for Mount Laboratories UK Limited in Ghana. They're actually a member of the chamber, platinum member. If you are interested in laboratory equipment and consumables, then please do get in touch via rubygolo tradeconsult.com.gh. Delighted to be here to learn and network. Thank you very much, Ruby. They have your details here, so they'll definitely get in touch. I have one question. Why are men at high risk of being hypertensive?
Why are men at high risk of being hypertensive? So our daily routines, right? Looking at our settings, a lot of men are actually very stressed. They tend to be exposed to doing the most strenuous stuff. Their diet habits are so terrible, and all these really are modifiable factors, but then it puts them at risk from developing hypertension. So that's why it's putting them most at risk of hypertension.
Okay, we're running out of time now, but I still have some questions. I have Mr. Nigel Mount's hand, his hand is raised. Mr. Nigel Mount, you can go ahead with your question.
Hi, just an observation I want to make actually. I noticed in Ghana, the number of deaths has been recorded about 340. In the UK, it's about 109,000. Any idea why it's such a drastic difference between the two countries?
Okay. So with a lot of people dying outside and a lot of people dying within, we have first I want to talk about our studies going on is also comparing our weather, saying that the virus is unable to do well in extremely warm conditions. So that's one. And then the second part is this, looking at the number of people that would have comorbid conditions might also would give us an idea as to why a lot of people are using it in the UK as compared to Ghana. And then the third bit, I said I didn't have a paper on most of these local preparations that people are consuming. Example is the neem, inhalation therapy that's going on. But then you realize a lot of people actually using a lot of herbs to help them get to actually help them get better and actually to prevent these diseases. A lot of studies have not yet been done, but I'm pretty sure they will all have a part to play in why actually people are actually not showing a lot of symptoms and are actually getting better. And then the other bit too is I think not to discredit the UK, but I think my colleagues are actually also doing a very good job helping them actually get better. So I think it's some of the things I want to say about it.
Okay, thank you. Mr. Mount, I hope your question was answered. I have another question. I'll take two more last questions and that will be it. What generally causes skin allergies? This is from Leslie Otute Glover Api.
So what generally causes skin allergies?
Yes.
So we have what we call allergies. Okay, these are the things that causes allergies. So different people have different things that cause allergies. So basically having an allergy is being hypersensitive or reactive to something. So someone can actually have shea butter on the skin and they'll react to it terribly. That's even another person is going to use shea butter and react terribly to it. So basically, not knowing what you are allergic to and exposing yourself to those allergens is going to help cause you to have terrible skin allergies. So our advice if you get to know what we are allergic to and stay away from it, then we are not going to get any skin allergies at all. I hope I answered right.
Okay, thank you. And what are some of the foods for immune system? The foods that will boost your immune system, an example of foods that boost your immune system.
Okay, so a lot of fruits, vegetables. I also advise we go for whole grain. Actually, when we're looking at carbohydrates, we have two types of carbohydrates. We have complex carbohydrates and we have a simple carbohydrates. So when I'm talking about simple carbohydrates, we have the normal sugar that we are having, and then we have the fizzy grains that we're taking. They're readily available. And our advice, we go in for more of the fiber-rich, and those that tend to have a lot of complex carbohydrates like rice, meat, millet, and all these food are high fiber, and we tend to also protect us a lot because of fiber. Fiber is also very good for the immune system. And these will also help. And then let's tend to drink a lot of water. Let's have zinc-rich foods. Let's have adequate amount of proteins in our meals. I'm sure we should be good.
Okay, thank you very much. And we have a contribution from Marian Adupo. Protective effect of estrogen is an additional factor to protect women before menopause. After menopause, the risk is almost about the same. So thank you, Mariam. And thank you very much, Dr. Michael Acquah, for your talk. It was very interesting. It was very insightful. Thank you for the audience as well. I hope you enjoyed it. And then you will be joining others in the future. For non-members of the UKGCC, if you want to get into contact with the UKGCC, be a member of the UKGCC, I've put the details of who you're going to reach. You're going to reach me on my number and my email address. I put all in the chat box. And also you can follow our social media platforms on Instagram, on LinkedIn, on Facebook, and we have a YouTube channel as well. So you can follow us on all these platforms. I have all the IDs put in the chat box as well. I have one new message. Okay, Judality says thanks. So Michael, do you have any other closing words? Sorry, Doctor. Dr. Acquah, do you have other closing words? If not, we will just close.
So I think the last note was to say is let's go for annual wellness, or let's have health screenings. Let's take our medications. Let's keep safe out there. Thank you.
Okay, thank you very much for everybody who was able to join. I will end the session. So hopefully we'll see you later on in the other events. Thank you.